share something in relation to what is status in your country. So we're going to learn from different regions, and also we shall have someone from Pakija also share an idea on what they're doing, and then you can delve into the consultation that we have here. So over to you, Arin, who is going to welcome us here. Then later on we'll go into the discussion in detail. Arin, Emily, do you have someone? Is Dr. Johannes on call or someone presenting him? Emily, do you have Dr. Johannes or someone from Arin officially welcome us to this as regional partners? Hello, do you have someone from Arin? Okay, I'm still waiting for see someone from Arin, Africa Research and Impact Network, who are the co-conveners for this workshop to officially welcome us here. I don't know whom we have here. I know Emily. Do you have someone to do that? Then you can proceed. Okay, as we wait for Arin and the team to join us, I wish also to recognize that we have partners who have in the region who worked in on this. The agenda is to consult as a civil society on what areas do we need to work on to strengthen climate and health research in Africa, and what is our role as civil society in advancing climate and health research. And definitely, this is the space we're going to work closely on, and ensuring that we work together to ensure that we strengthen data generation on climate and health research in Africa, but also use that data to inform programming and advocacy for interventions geared towards strengthening the climate resilience of a health system. So that's the rationale why we're here. We are, I wanted to hear it from Arin. Of course, I know they have a big program supported by Wellcome Trust on engaging on this. So I wanted, I don't know if Emily, do you have someone from Arin to officially? Hello? Okay. So as I said, there is a program already, which I know Erin will be coming to consult us on what are interventions, but also along the way we shall have someone from School of Public Health Makerere to share findings from the VAA vulnerability assessment, adaptation assessment for health, climate change that was done in Uganda, but also learning from the teams from here, Pakija. I wanted to know whether they're already on, but we can move next phase of the discussion. I have someone from Pakija here. Trying to get one here. Okay, so Arin and Pakija key partners I want to work with, but also Africa Public Health Research Center, Nairobi, who are doing a program supported by Wellcome Trust. So they will join us along the way. But as I said, the essence of why all of us are here is to share ideas on what strategies need to be put as civil society in advancing climate and health research in Africa. This is basing on the knowledge that we know climate change has greatly affected the health sector, and therefore, as well, society, we have a role to play. So, as the RN team and Paja team comes on board, I think they will notify me. We want to see health and what should be our role as a society in advancing climate and health research. The discussions are already ongoing in ensuring that we have, and those are the ideas we're going to have as a society to learn from and ensure that we synergize to have this center we are, of course, a discussion with the School of Public Health and Arin and the team that Makerere University would be hosting the regional hub for this. And definitely the opportunity for us in Africa to have this Center for Research and Health on climate and health in Africa established, but also as a civil society, we have a role and learning from what you're doing. The data we have is much of it is led by the global agencies like WHO. We quote them, but we want to get our own data emanating from Africa and being led by the Africa. Earlier on, Dr. Uzodina from Nigeria has been driving this agenda for long, and definitely, and he leads us at the global space as a society, but also helping us to work together on this. So, Dr. Uzodina, I wish to welcome you, give us a perspective at the region and the global level as for society, because you are leading us there. And if you have something to share with us as a society, what you need to know as Africa region, but also learning from the global
Excellency,
spaces you have been linking us to great work you're doing. So you go come on and share with us what have been on at the regional level, but also link to the global space, civil society, and at the global space. Over to you, Doctor.
Thank you, Excellency, my brother Raymond Rioka. You are our leader. I respect a lot. And I also have a lot of respect for everyone here. You see, Africa is gradually becoming the center space for the climate crisis, mainly because our approaches and capacity for mitigation is low. So because we are increasingly donor dependent, there is also need for us to begin to get innovative at the global level and especially at the African level and within the civil society. We mustn't fail to remember that we represent the community. So our innovations would come from the communities. In trying to talk about climate change, let us remember that this goes through the whole hog of biodiversity, environmental issues, energy efficiency issues, renewable energy issues, conservation, and of course, the climate change itself. All these are linked together, and the apex of their linkage is climate change. It is climate change that has made it difficult for our people to feed themselves at a time like this. In a country like Nigeria, and probably for the West African sub-region, drought have led to insecurity. People move to places they are not sure they are welcome, so they become aggressive in relating with people they visited. Drought has led to hunger. This is climate change impact that we must work together with our communities and governments to work on. And you know that all these are also impactful on health. If you check the crisis of health we have now, they are also linked to climate change. Let's do all we can to get this done. On behalf of Afri Health Alternate Association and of course, the Global Civil Society Consortium on Climate Change and the Conference of Parties, I wish us well. And we look forward to the report of this meeting and how it will impact and be used to impact on climate crisis within our continent and indeed the world over and our communities. Thank you and welcome.
Thank you very much, Dr. Uzodina. We appreciate your work in ensuring that we, as society in Africa, participate in the global spaces. I know you would have talked as well on about the upcoming program for COP29 that will be held in Azerbaijan, Baku.
Sorry, sir. Let me put in a word on that. Sir. Thank you, sir. You see, we, and when I mean we, all of us, including Raymond, we are working to see that the first thing that the GCSCCC is working on is to ensure that civil society is given enough space in COP29 in Azerbaijan, and that we have started working and we started preparation. In the next few days, we will the steering committee will get working and we'll set up subcommittees. I want to appreciate specifically the role my brother Raymond has been playing in ensuring that we link up with Azerbaijan in this process. Let me also say that as we move on, the civil society should not forget that its responsibility in climate change transcends through partnership building, advocacy issues, communication, transcends through the issues of research and providing evidence for intervention, transcends through the issues of capacity development and making all of us be at the same level. We need to also promote outreach so that our communities will get to know what this is all about, because most people do not. And indeed, the area of monitoring, evaluation, and reporting is very germane to us. Let us not lose sight of it so that we can always follow the money and know what it is used for. And also follow the project and know what they are delivering, what the gaps are, and what we can do to make them better. Thank you so much, Raymond. You may take over from here, sir.
Yeah, thank you very much, Dr. Rodina, and thank you for, as I said, leading us on this space. Colleagues, we know that climate change has a great impact on the access to health services in our respective countries, and we have testimonies to that. The impact has been there. We have seen health facilities being washed away, infrastructure with roads. We have seen our machines being spoiled because of the climate disasters. We have seen people dying because of disasters where women cannot access facilities. All these areas we need to discuss on together. The other thing also is we need to also be cognizant on what has been happening in the global north in relation to the impact, but also for us in global south, how in Africa, how the impact has affected us. So we're here to share those ideas. That said, I wish now to invite a team from ARIN to share with us briefly about the projects they are working on, and also give us a rationale why it's important to have this CSO society part of this discussion on climate and research in Africa. Emily? Emily, are you there?
I am here, thank you.
Yeah, thank you, go on, thank you.
Okay, good morning, good afternoon, depending on where you are joining us from. My name is Emily Bolo, a research associate from the Africa Research and Impact Network. I'm here on behalf of my director, Dr. Joanne Zatella. He is busy engaged in another meeting, so I'll briefly introduce the study. So the FGD that we're going to have today is a part of a project we are doing with APHRC on consultations on community of practice for transdisciplinary research and action in Africa. The aim of the study is to identify opportunities for addressing the critical intersection of climate change and health with a specific focus on Africa. It aims to understand that to enhance the understanding of how collaboration and action can help integrate health considerations into climate change policies and systems by engaging a diverse range of stakeholders. From researchers, policymakers, communities, and even CSOs, the project seeks to identify effective strategies for promoting resilience and equitable outcomes. So far, we have done with phase one. That was more of an exploratory phase that involved comprehensive stakeholder mapping, needs assessment, and awareness creations via monthly webinars. So far, we have done 3 webinars. We have one remaining webinar, which will be done this Friday. And on that note, I'll share a link in the chat so that you can feel free to register and join the final webinar that we have this coming Friday. We are now moving to a more targeted phase of the study, which is will specifically focus on the FGDs. This is the first FGD that we have. We have a series of like 4 So this is the first one that we have for the CSOs. And the aim of the FGD is to identify and prioritize regional needs and challenges based on emerging landscape in climate change and health in Africa. So your contribution to this FGD will be highly appreciated. And I want to thank you all for finding time to join the meeting in such a short time. And we hope to get more from these discussions. Thank you so much, and back to you, Raymond. Oh, I think I have my colleague here, Anne.
Thank you very much.
Yeah, I think I have a colleague called Anne. If she can hear me, kindly introduce yourself, Anne.
Okay. Anne? Our colleagues, these are the team from ARIN who are with us on this program. We hope to work together in this program to ensure that we synergize on ensuring that climate and health research is prioritized in Africa. And we also had invited a team from Pakija. Do you have someone from Pakija here? The Benson and the team. Okay, I think they're not yet here, but we had also worked closely with the Pakija, which is a key collaborative agent in relation to climate and health in Africa. And we wish to welcome them to this discussion. At the regional level, as I mentioned, we thank the team that is working on ensuring that we synergize to ensure that we work together on having these ideas discussed. As I mentioned, as Emily has mentioned, we are here to give these parameters on what is your view in relation to climate and health research. And we want to make it not that formal, because otherwise maybe Emily might have formal related engagements on this, but we want to first listen to you as the players in this area. You just first raise your name with FGD to find out from your perspective, what is your view in relation to climate and health research in Africa, but also the role of civil society in advancing this agenda. Then we shall later on delve into the practicality, as I mentioned, with the teams from the research element. So you are open to raise your hands and share your view. But also, as I mentioned, we also invited other teams to join us to share from the Global North. I see we have Rita from University of East Anglia. Rita, so we thank you also joining us here to share on the perspective. Maybe before we go into the others, I would request you, Rita Issa, also share with us your idea in relation to the feeling what we are doing and what you think climate and health research in Africa should focus on. Thank you. Over to you, Rita.
Hi, lovely to meet you all, and thank you so much for opening this invitation for the meeting. I'm just dialing in from just outside Nakuru in the Rift Valley in Kenya, and I'm here working with an Indigenous organization around loss and damage compensation in the context of climate change and health. My focus is specifically on mental health, and I'm just interested to know how we can utilize health evidence to be able to call for adequate adaptation and loss and damage financing. So thank you so much for having me. I'm going to be in Africa for the next couple of months or so, and hopefully back and forth over the couple of years that I'm finishing up my PhD. Thank you.
Thank you very much, Rita, for sharing, and thank you all as well for joining this call. And we look forward to discussing together on this, and definitely working closely, learning what you're doing especially on financing. We know climate financing is paramount, and definitely we need to look at synergize on how do we generate resources, but also working with governments, especially for research and collaborating together in this agenda. Thank you very much, Rita. I know we're going to participate together in this discussion. I know we have some tailored questions for this, but I wanted first to hear the members' views. Then we go to tailor the question that we want to do the members. So Rebecca Chivumbi, share your views. So other members also you can raise your hand and also give your views as we discuss. Thank you.
Okay, I greet you all. Hope you are all fine. Thank you for this meeting on climate and health research. As civil society organizations, we have a role to play in this health research. And as civil society organizations, first of all, we represent the community, but we are also working with them in the community. So our research would be very nice because we've noted of recent, there's a lot that can be done in the communities. I'll give an example of when you are moving around cities, you see blocked drains, which lead to flooding. You see when it rains, the El Nino that has been around, if everything was going well, there wouldn't be any flooding in the cities. If the drains were working well, if the communities were not blocking the drains, wouldn't be having a flooding, wouldn't be having maybe diseases such as cholera. So as civil society organizations, we have to come in and first of all, participate in the research to see what is really, what does the community need? Do they need to be educated? Do they need to be assisted to unblock? Do they need to, generally to
Rebecca, we are missing your thing. Your network is poor. Hello, Rebecca. Okay, I think we have a connectivity challenge with Rebecca. I wish now to I see the hand from Dr. Zodina again. So, Doctor, go ahead. I think Rebecca has an issue with the network. Over to you.
All right, thank you. To the chair, I think the important thing about research is that we undertake research essentially to generate evidence for action. So in order to do some research intervention, we need to start from basic needs assessment, environmental scope, community scoping on climate change issues, do some needs assessment, and then check, because of limited resources and technical know-how availability, we then check which of these needs, as found in needs assessment we would have done, has the capacity of affecting and providing more solutions to address other issues if we embark on it. Problem and concentrate our research on it, and then generate enough evidence that involves the communities too in the study. So it has to be inclusive, it has to be evidence-based, and it has
Hello, Doctor. Hello. Doctor, I can't hear you.
Got one person.
Okay. Let's have Olabo Daniel.
Thank you very much, Raymond, for your very good moderation skills. And I also want to reiterate what I've just said. So that so I was saying that we very much appreciate this initiative collaborating on climate change and research, because research is the basis of our intervention. Or to take in a particular intervention. In Uganda, we are aware of the different impacts of the climate change, whereupon medical and cause drought, as well as cause a number of huge challenges in the country, particularly I'm speaking in the context of Uganda. So I feel like this evidence research will inform much and more of our engagement and capacity required. And I don't want to too much go into the gap in country, particularly in Uganda, but of course, if this research will help us also to build and of course get more funding in the aspect of responding to climate change, particularly in the health sector and other vital, sectors. So I very much appreciate, and we're looking forward to further engage and see that we put this important research into perspective and to a doable intervention. Thank you very much.
Thank you, Daniel. Thank you for sharing your view. Can we listen to Eva Mwezi?
Thank you very much, Raymond and members. Thank you for the opportunity. This is Reverend Canon Everett Mugarura. I represent a number of organizations for the civil society. I'm the Executive Director for Africa Youth Leadership Development and Health Initiative, but also Chairman of the East African Regional Fellowship for the Boys and Girls Brigade. As you know it, those who know Boys and Girls Brigade, it cuts across Africa and targeting young people. Then on the other side, I am a lecturer at Uganda Christian University in the Department of Public Health, and where research, kindly mute so that we are not distracting. Where research is definitely central to all that we must do. So to the point of thinking along having research on climate, on the intersection between climate and health is definitely timely, and especially if we are doing it as a region, because most times we have implemented programs that are generated somewhere else, and therefore it becomes very difficult to tailor them to our situation. But with evidence-based research that is Africa-based and in the same subject, it means that it will inform appropriately our interventions, and therefore it will be more tangible, it will be more realistic, and hopefully it will address the key issues that we are faced with as a region in the global arena. So I definitely highly appreciate this initiative, and I look forward to us especially targeting the research institutions, universities, where research is key, and other institutions working together with the civil society, including the faith-based organizations, and not leaving out the young people. Thank you very much, because we want transformational interventions, and young people must be at the center. Thank you, and God bless you.
Thank you. Yeah, thank you, Reverend, and thank you for coming on board on this. Let me listen to Senoga Martin Kizito there before I go to our teams from the region.
Raymond, you are forgetting my name, as yet I'm your friend, Senoga Martin Chikozi. Thank you so much for making us be part of this very, very important consultative meeting. I'm Senoga Martin Chigozi. I work with the National Union of Disabled Persons of Uganda, NUDIPU. We are an umbrella organization for persons with disabilities in Uganda. And definitely, I agree with what the former speakers are saying. This research is very important, especially that it is African, and the collaboration with the North, Global North, is also appreciated because there is definitely a lot that we have to learn from them. I just want to make an appeal that as we research into climate change and health, we don't forget persons with disability, because as we talk about climate change, persons with disabilities are like the most affected, since they are dependent on climate, they are dependent on rain for their agriculture, rain-fed agriculture. And if the agriculture is not good, it also impacts their nutrition, and this definitely impacts their nutrition, the resistance to diseases. So I think having persons with disabilities into this conversation is very, very important, and it would be appreciated that the research does not leave out how climate change and health impacts persons with disabilities. So we are very grateful, and we think this is the way to go. Thank you so much for this consultation.
Thank you very much, my brother Senoga Martin Kigozi, talking about disability inclusion in the climate and health research. That's very, very important, because we know the sector is much vulnerable to shocks to the climate. They are most vulnerable communities. So thank you very much for amplifying that voice for the disability inclusion. I want to have only two, so that our regional teams can delve into the questions that have been set here. I want to listen from our colleague from Rwanda, Ese Yao Zakpa. Ese, could you share your view in relation to Rwanda? Then I will also call upon my friend Olga Liza to pick up from Botswana. We want to hear your views. Ese?
Yes, please. Good morning, everyone. Thank you very much.
Yes, sir.
Yao. I'm a postdoc researcher at African Institute of Mathematical Science. Here we are working on climate and health. We are developing methods and statistical framework to analyze, to assess the interaction of climate change and health. And one thing I want to mention is to put institutional research institution in the center of this project. It should be very helpful because we know we cannot talk about climate change and health without doing modeling, without developing models to have the real impact on health. Knowing the real impact can help us to design like warming systems, earlier warning system that can help to cope with those climate change impacts in advance. Thank you very much.
Thank you, my brother, for sharing your view in the area of work, and thank you very much for joining. I want to request Olga Liza from Botswana. Olga?
What the mining side?
Hello?
What side?
This is muted. Okay. As we wait for Olga, I wish to now share of course, set question that we want to have your views on. As I said, this is the consultative nature, and we would like your views in relation to these set out questions. And we shall look at 3 categories, 4. One will be based on research, policy and practice, capacity building, and the intersection sectoral or disciplinary coordination. So these for the 4 areas we think we can do better to amplify the climate and health research in Africa. And I wanted to get your views in relation to these 4 under research, especially looking at question 1, A, B, and C, and D, about what is your opinion on the sufficient evidence to inform action on climate and health, and what measures can be taken to improve data collection and dissemination in this context. So members, raise your hands so that I can have you share your views about your opinion on sufficient of evidence for action, climate and health, and what can be taken to do that. Any, maybe you can even unmute and then share your views on this. The second question in relation to research is, do research agendas on climate and health exist at the regional or national level? If so, which are they and how relevant are they to the region or the country? The other one also, are there dedicated institutions that are focused on tackling climate and health in the research? Of course, on the names of institutions and location that can be supported further to this agenda. Members, these are the questions under research. Wanted to hear your views. Kindly unmute. Maybe Emily, since you are the one leading on this, kindly come in. I request you to.
I was thinking to save on time. Will it be okay if we divide them into the breakout rooms?
Come again?
Because to save on time, will it be ideal if we
Yes.
break out the participants into different breakout rooms? So that group 1 handles research, group 2 policy, group C capacity.
Okay, that could be a good idea. And I wanted to request you to handle that. That'd be better, as members can discuss in the respective groups, and then we can come in to now facilitate the meeting together. These are the 4 areas. So I request now, Emily, you take lead in this. Thank you. Can I put it down? Then you can project from your side.
Okay, you can. Let me try creating the rooms. You can
breaking the rooms. Members, I don't know. Will we look at those interested in each section on research, on policy, and practice, capacity building, and intersectional coordination? So any of these 4 areas, we're going to have these breakout rooms, and definitely share those ideas within our groups. Feel free. I know I will request that Emily will randomly take you to a room, so you discuss within there. So thank you. So over to you, Emily. To the questions and then in the discussions in those breakout rooms. So you can join any of the groups. So put room 1. So go ahead, Emily, on this.
Yeah, kindly stop sharing.
Okay, let me stop sharing.
So that I edit.
Yeah, sure. So members, the rooms are set. So kindly can go to any room. We mentioned one room is on research. The other one is on policy and practice. As what's been mentioned therein. And also the other one room also is on capacity building, and the last one is on the intersectional coordination or disciplinary coordination. In a short while, members, as you come back from the rooms, we shall have Dr. Isungo, who will be sharing briefly about what assessment has been done. I see someone has a hand up.
Hello, Raymond. Good morning,
Dr.
everyone.
Hanan.
Yeah,
Good morning, everyone.
Yeah, Hanan Al-Amin from Dania. Thank you. Actually, just my question raised to Emily. There should be a group regarding the financial issues because it's very important.
Oh, yes,
and we need
yes.
Yeah,
Oh,
so
yes.
it's not considered. Yeah, so it's very important. Yeah,
Yeah,
thank you.
thank you, Dr.
Because
Hanan.
the
Yeah,
issue of
finance.
TAP
Yeah, yeah.
and the adaptation fund, that issue.
Yeah.
Thank you.
Thank you, Dr. Hanan. Yeah, talking about financing. And remember, Rita earlier on alluded to the same. So, Emily, is it possible to get a room for financing? Remember, talk about finance. Finance for climate research, climate and research. Oh.
Like there.
Okay, we were seeing members joining, but we still have members in the main chat. Can the members? Emily, is it possible to have another area for financing?
Yes.
And I request Dr. Anand to lead that team. I know Rita is also passionate about financing. Thank you. Emily? Okay. Meanwhile, we will thank members who are joining different rooms. We still have more with us here. Kindly, Emily, are you possible to create one for finance? I'm also passionate about finance as well, so I can also join however much I'm moderating here.
So,
okay, all maybe in the same. Could we integrate in case Emily doesn't open a group specific for finance within the discussions? Emily?
Yes, sure. That would be a good idea. In the various sections, they can incorporate the finance aspect because it's important in all the 3 areas, the 4 areas.
Oh,
yeah.
So you're proposing that it is looked at as integrated nature in this discussion?
Yes.
Okay. Yeah. Okay. That's a good idea. So thank you, Dr. Anand. Thank you very much, and we appreciate Enviro Sudan for the great work being done already. Thank you. So let's have financing integrated in all the 4 thematic areas. So members, so let's join the groups. I see you have 20 members still with us. Yeah, just joined. Let's have all of us join. We shall have 10 minutes. It is 10-15 minutes for this discussion, and then we shall come back to the plenary. Okay. Groups and get a group till someone to lead your team, and then we can have you the different questions, the creative question that you have put here. Then from your group, kindly from each group, as said by my colleague earlier on. So I would also have loved to have an area to talk about gender. Gender and the climate justice in cutting areas. So gender, inclusion. So can we say, members, that now all of us have gotten the rooms? Q members go to the rooms and share ideas from there and immediately start the meeting. We have only, we'll give you only 15 minutes for this, and then we come back to the plenary. We'll be sharing what you've learned from the groups. Okay, I still have 15 people with us here.
I can assign
Members,
them.
let's go to the groups.
I can assign them.
Come again? Yeah, please do.
So Raymond, I don't know if they know the question they're
Yes.
addressing. I will propose room 1 to address the research aspect.
Yes, in that area.
Yeah,
Room
room
1
2,
is addressing on research, then room 2 on policy,
yes,
room 3 on capacity building,
yes.
and the room 4 it is on interdisciplinary and coordination.
Yeah, sure. Thank you.
The coordination disciplinary, yeah. So that's an area. Members, let's go to the groups. I see number of groups have been joined in. We won't have 5 minutes for this, even less, and share ideas in. Okay, I hope the groups have the questions. We can project them. Emily, how do we project them in the groups basing on those questions?
Typing the questions in the chat. I hope they'll be able to see.
Are they in the, maybe send I can send the document in the chat. Have you sent the chat?
Yes. Yes.
Okay. Members, the questions are in the chat. You look at the document attached. Group 1, we are talking about research. Group 2, policy. Group 2, policy and practice. Group 3, capacity building. Group 4, intersectoral disciplinary coordination. And you need to don't forget about financing among them. People to do they are interrelated. Financing, gender equality, the inclusion, other cross-cutting areas. So don't forget them. Research is group 1. So RB go straight to group 1. So Abdul joined group 1, that's for research. And the question I won't put I've been put in the chat. Someone is asking for help in group 1. Colleagues, we are trying to go to the breakout rooms to ensure that all members on board. I see 15 members here in the main room. I want to let me go to members. We still have 15 members here. We need to have the groups. I see a number of them not yet assigned.
Raymond,
Let's go to the groups.
Raymond.
Yes.
This is Evert.
Yes.
Yes. You put us in room 3, but you never gave us an assignment. So we are wondering, what are we doing?
I'm here for the same.
Hey.
That's why I've come here. I was in the other breakout rooms as well. So I've come to group 3 for the assignment we're doing. Our role is on capacity building. As you see on the screen. Do you see my screen? Do you see our screen? Hello? Hello? I can't hear. Hello, colleagues? Can you hear me? Let me see if... Hello? Can you hear me? Okay.
I can hear you. I don't know if the rest can hear you.
Hi, Raymond. It's great being here.
I don't... can you hear me? Members, this is group 3, right? Capacity building. Yes. So assignment is discussing these three areas about the capacity building. Are there integrated climate and health courses or fellowships in your region, your ideas? But also, are there any dedicated professional exchange programs? But what other kind of capacity building conferences are taking place in the region, in your respective country? But also to capacity building, don't forget about finance as well. Discuss about finance in relation to capacity building and also issues of inclusion. So that's the task we have. We have only 10 minutes for this, and then request to have a chairperson as a note taker, a secretary, who will now later on after 10 minutes we will take you back to the group. So are we together? Members, volunteer yourselves to take lead and also support on the discussion and taking notes what the groups have been discussing. It's the voluntary basis here. Can someone take lead? These questions have been put in the chat, so you can also find them there by Emily. Hello? Members, can you hear me? Can you hear me? Are we able to go on? I need to go to another group to also brief them on this. I want to be sure that all of us have taken note on what capacity building wants to discuss on. It is open discussion, members. Hello? Hello? Members, I can't hear you. Are we on here, members? We need your views, members, on this. So can you get someone take lead and then have a discussion? Reverend Everett. Reverend Everett? Hello, Reverend Everett?
Yes, please.
Yes. Could you take lead on this, discussing this?
Okay.
We'll have the members participate, yeah. These are the areas. Yeah.
Okay, so thank you, Raymond.
So
and thank you, members. How much time do we have? I wonder how much time we have, but
we'll go to another group, group 4.
Let's use the
10 minutes from now.
Let's use the shortest time we have.
Okay.
To work on this assignment.
Okay, thank you.
Yeah. Okay, members, we have the screen is gone now again.
Reverend, they are put in the chat. The information is in the chat.
Okay.
Yes. But if I can screen again, just for capacity building, the areas we're looking at. Can you see now?
Yes, we can see it now.
These are the 3 areas, but also including financing for capacity building, innovation financing. Also need to talk about it, but also the inclusivity. So these are the 3 areas we think we will discuss on. Integrated government sales courses, fellowships, the dedicated construction exchange programs, and what other kind of capacity building, climate and health are taking place in the region, in the respective countries. But also including climate financing in the discussions. Is it clear?
Yeah, it is clear. So members, you're welcome. We have the questions before us.
It's clear? Okay.
Let's now go to question number 1. You know, this thing disorganized me. I had to go. Let me go to the chat. Yes, question number 1 deals with are there integrated climate and health courses fellowship in your region, e.g. short courses, master's program, or PhDs for each, so we can talk about this in response to the assignment given. I think we can brainstorm. Are there integrated climate and health courses or fellowships in your region? Could be short courses, could be at master's level, or even at PhDs. Yes, members, we need to, this is majorly to do with maybe country by country. For instance, in Uganda, if I could go, because I'm part of the participants, I am not, apart from the environmental health that is offered in some universities, I have not seen a definite or specific course that looks specifically on climate and health. It looks at the environmental health, of course, including climate change, but not specifically for climate change and as it relates to health. So I don't think we have such institutions as far as my knowledge is concerned. Others, please. Do you hear me? Hello, members. Hello.
Hello?
Yes, Hatim.
Yes, just I lost my group. I was in three. I don't know which topic now because I rejoined now and I came to this.
We are now we are tackling this topic on capacity building.
Yes.
And the first question is, are there integrated climate and health courses or fellowships in your region in form of short courses in terms of, even having it at master's level or even PhD? I don't know about your area, but for me, I don't think I have seen that specificity in this field.
Yeah, okay. The invitation for me to join Room 3, but I am in Sudan, Port Sudan. There is no courses or special courses for climate change, no institutions. We have just only the environmental government environmental institute, and now because the whole country is affected by the war and rising conflict, nothing is there. All people were displaced, and this caused a very big climatic problem here in Sudan. Now I am in Port Sudan, it is the coast of Red Sea. Also, they have a small association of environmental, but it is not funded. It's very difficult for them to work, no activities, nothing there. So this is the capacity building, this and institutions build this capacity building. We are lacking this too much. Thank you.
Okay, other members, any other person with contrary view? Because what we are seeing here is that, hey, this one is asking me to join.
Hello, assalamu alaikum. Hi, Beth. Hello?
Hello, has the moderator dropped off or you're here? Hello. This is Josephine. I'm just trying to find out if the moderator is still here or is dropped off. Then someone else can pick and we are able to come up with some bit of content to present in the plenary. Hello, anyone here?
I think the moderator has dropped off, and it is something which is all cutting across all groups. Some groups are mute with no any communication. So I think you can take it up from there.
So the question was, if we know about any trainings that are happening in those areas that they mentioned, either PhDs, the master, either short-term courses, or even youth universities are doing, we just need to mention that. So that this is what we'll take into the main plenary, because you might have this information, you might have some privy to this information and you can't share it out. But also we need someone to take actually notes, so that there's one person moderating and then the other takes the notes, and then these notes we can share them in the bigger plenary. So can we start from there as we wait for Mugarura to get back on?
Yes, we can continue because we are on.
Yes, please, do you want to take some notes? Either you can take them on your laptop, then we can just project. I don't remember the questions, but if you can just...
I prefer somebody else does it because I'm not in position. But
you're not in position?
Yes, please.
Okay, thank you, Peace. Anyone else who can help us? Lillian Kamanzi, can you help? Or Julia Sopio, anyone who can quickly come up and say, I'm going to take the notes, so that we can quickly know that just one person is moderating, one person is taking the notes, and then we'll take it back. And to preferably if you can use your laptop. Hello, anybody here? Hello, Raymond. Could you just again project for us, leave for us the questions we are working on as in this group, so that we are able to reference back to those questions all the time, so that we can share them here, and then people are able to see what we are focusing on.
They are shared, they are there.
Okay, yeah, but this is intersection and projection. Just go here, capacity building. Yes, thank you. Capacity building, where are we?
Which one?
Capacity building. Capacity building. That's what this was, yes.
Okay, these are the areas we're looking at.
Yes.
Yes. You can see now?
Yes, we can see. Thank you.
Yeah, so these are the three areas we talk about, but also requested also you add on financing, capacity of financing climate and research in Africa. So also you discuss these are the greatest courses, fellowships, risk capacity building, and dedicated professional exchange programs. But what other kind of capacity building kind of are taking place in the region? Share those ideas, including financing, capacity finance, these interventions on climate and research.
Okay, I think
are we together?
Yes, we are. I'll just ask that if we can, how long is this session going to run, so that we are cognizant of the time?
We need to
10 minutes?
By 30 minutes, we should. Yeah, 10 minutes. Yeah, yes.
Okay. Okay, thank you very much, Raymond. So could we just, as we wait for Mugarura, I kind of picked up the...
Okay. Let me go to another group.
Okay, thank you. If you can just...
They were even shared by Emily in the chat.
So
you picked some
can
areas.
You leave this? Can you share it on the chat so that you can
exit the chat already? It is in the chat already. Yes, yes.
Okay, I've seen it, maybe. Okay, I've seen it. Thank you. I've seen it here.
It's the chat already in financing, capacity building. Yeah, thank you.
Okay, I have seen it. So members, I don't know whether Mugarura is back here, but if he's not, can we quickly just speak about the different capacity
Someone is
building?
saying that we will share. It's already in the chat. Someone, I think Dr. Hannah is saying it will share.
Yeah, please, Raymond, because I'm just joining because I have a confusion. I just joining room 3, but there is nothing there, and I have to come again to the main floor. So please reshare it. Thank you.
These are the questions, and they are in the chat already. And Josephine is going to elaborate more on this because she has seen them already. Okay.
Okay. Yeah.
Okay. Thank you.
Thank you again, everyone. And we had Mugarura moderating this session. However, he dropped off and I just picked it up, and we have only probably less than 10 minutes. So based on the questions that were shared in the chat, and you can all open up your chats. This is screen sharing. So if we go back, we're looking at capacity building, and one of the things we're looking at, are there integrated climate and health courses or fellowships in your region? And this region could be east, west, south, central, wherever we are. So if you can just mention, or if you're not able to mention, we could actually throw them in the chat if you're not able to speak. And then we had said we wanted someone to actually take the notes. And Lydia, could you help do that if you can? I see Lydia Mukombe. Can you help pick the notes? Hello, can you hear anyone speaking? I see Lydia, you're trying to speak, but you're muted. Jackson, could you take the notes? Or I can take them while I moderate at the same time writing them. So hello, people, again. Do we know of any integrated climate and health courses that are happening within our regions? The courses could be masters, it could be fellowships, it could be PhD, it could be short-term courses. Let's just mention, or you can even mention the institutes or the organizations that are doing this. We just want to have access to that information. Thank you.
Josephine, I've just typed in the chat. I might not be able to talk a lot, but I promise to cross-check with the Amref Health Africa University, which is based in Nairobi. I know they have developed some short courses on health and climate change. So I'll share that. And I think many of them are on an e-platform. And of course, there are also those that are face-to-face, but I'll be getting back to you on this. Thank you.
Thank you very much, Lillian Kamanzi. And we look forward to you sharing those, that, or you could directly share with the Yardnet as well, that is probably is going to put this together. Any other addition to what Lillian has said? Who else is who's doing courses around climate and health that we need to know within this space? Short masters, yes, Hannah?
Yeah, thank you so much for leading even this session. I'm from Sudan. Actually, my experience goes with WASH sector for like several years, maybe 13 years. We have like such model of the issues of diseases or vector diseases, like has inputs with climate change, like chikungunya and dengue fever, issues like that, need to be considered even within a term of research work. It's needed even for the vulnerable people and in remote areas. Another issues we have, like environmental studies institute in Sudan, goes deeply with issues of climate change and health impacts and issues of mitigation, resilience, and adaptation. Another issues goes to the schools. There is nothing on that, like the syllabus even, or even non-formal sessions. People are not tackling the issues of climate change like it should be as a risk. within school syllabus and universities and others, even with doctors or clinics courses, short courses. But nothing like that, but just given by a certain institute for those students who are admission to the institute. The issues of financing, maybe Raymond raised the issues of financing, and I raised it, that it's very important to have it within research work. What about the adaptation fund and NAP issues of UNFCCC that the countries consider it? So it has been within their agenda to have such term of research, considering to cover the research work financially. Those just my input in this term. Thank you, Josephine. Over.
Thank you, Hannah. Thank you very much. And so we just go back to the question, and you don't have to. We don't have to follow the question specific chronologically. We can look at whatever you have based on the different questions or the guide they've given us there. If there are any, or there are no integrated courses that and how we can do integration to be achieved and how they can be made more effective. If there's no integration, how we can do it. If there are courses, we can speak about the courses. For capacity building, you can specify the institutions and the country where these are, if they exist, just like Hannah has mentioned. If there are any dedicated professional exchange programs, yeah. So we don't have to answer them. Did I hear a hand or not? Yes, back to the group here. I was just reading through the question, and we don't have to go through them as they're mentioned, but whatever you have, just bring it through so that we're able to present something. Anyone? Lydia, I think you've been trying to talk. I don't know whether you're in another group, but you're muted. Prudence, any information? Jackson Were, Moses Sylvester, any information to this? Anything we can add on around capacity building? What is happening in this sector in terms of climate and health? Hello. Yes, Peter Owiti, you have your hand up. Please go ahead and speak. Peter, go ahead and speak. Oh, Muhammadi, I think. That's Muhammadi, yes. Muhammad, you can go ahead and speak because I think Peter is not hearing.
I'm Dr. Fadl, Federal Minister of Health, Health Emergency Pandemic Control. I would like to confirm that already the issue raised by Dr. Hanan, I think from Sudan also. As from the health background, really, the climate change will affect it more, and also there is many diseases, as she mentioned, that chikungunya, dengue fever, hemorrhagic fever, a lot of things. For that, the climatic change is playing important role in this health impact in Sudan. When we go for the issue of the capacity building, that is the big challenges. No institute, I think, as she mentioned, that there is institute, but I think there is a miss of coordination because we didn't have actual research going to check what is the root causes of these diseases, and also what the actual impact of this climate change to increase this disease. For that, from this forum or from this meeting, I would like for the African people, if they have some institute, it is especially in the issue of climate change, I think better to help Sudan and also to find some research. The gap is the research. We just working like the fair fighting. There is outbreak of dengue fever, we're going to make a spraying, something like that. For that, we need actual studies and deep studies to help us to minimize or decrease the risk of the climate change. That's my input in this forum. Thank you so much.
Thank you very much. And I was just wondering, thank you very much, Muhammad. And I know we are looking at the challenges we're currently facing. And like I said, if you can't speak, just write in the chat, and we can pick that and take it to the bigger group. But also, let's try to stick to the questions, and we can be able to look at what is there and maybe what is not there. Because I'm also, I think Mohammed is just saying, I think they're having a lot of challenges, but they don't have any resources really to guide their work as well, and also as well as funding. So there's no capacity building and financing, and probably how to advocate for financing and increased funding maybe lacking as well. So yeah.
Okay, thank you.
Yes, thank you. Any other additions to capacity building that is happening in the region in all those mentioned areas? Any exchange learning that is happening that other colleagues need to know? Or I think the reason we're doing this because we need to put information there so that people know where to go. Thank you very much, Lillian. I've seen you've put here something from AMREF. Any other addition? Moses, Sylvester, Prudence, Jackson. Yes, apart from AMREF, anyone else doing capacity building anywhere else? I'm just going into the chat and seeing what is there. Primary health care workers, the course will be structured to tackle the following content: climate change. Oh, this is a continuation from Lillian, right? Lillian, right?
Yes.
Lillian?
Yes.
Okay, thank you. Yeah, thank you. Do we have any other information? Thank you very much, Lillian, for putting that in. I'm just copying it and putting into what we can give back to the. And you can put in a chat if you're not able to speak, but we're really looking at what is available out there in terms of capacity building, either in financing, in just generally climate and health, and also for different target audiences, maybe for organizations, maybe for donors at that level, who's really doing capacity building. You can also just mention the institution, and then probably can Yadnet can follow up and see what is there. Any other contributions? Okay, I've seen someone, Prudence has put the Uganda Public Health Fellowship Program, trains fellows from different backgrounds, including environmental health. How do people get to access? Any more detail to that, Lillian, Prudence? Thank you very much. Okay, so sorry. I'm conducting 2 minutes.
Hello. I think there is still a challenge when it comes to capacity building in regard to climate change and health. But that said, of course, there are initiatives, and really, it is an issue of realigning some of the initiatives being taken by non-government organizations in different areas. You find that there are those trying out to come up with environmental initiative programs which are friendly with the environment, but then trying to align that to understand their contribution towards the environment becomes an issue. Now, the case in point I would point out to, say, agroecology. For example, there could be some people, there are some people trying initiatives which are agriculture initiatives which are environmental friendly, but then understanding the context in which they are doing it still still is lacking. So in terms of capacity building, we are still having a huge challenge. Much as there could be people trying out to do things which support, there are still little effort in trying to align and document the same.
Thank you very much, Were. I think I can see that we are all really struggling in this area, and which meaning that there's not much information we have out there. And it's an area that we really need to see that actually people get information where they can get more understanding about how they can integrate climate and health, because I can see we've really struggled to work on this particular question. So I believe that probably we wait to go back to the plenary session, unless someone has anything else to add on here.
Yeah, I would like to add to the issues of technology transfer regarding the solutions of any problems causes by climate change. So the issues of technology transfer is very important, and applying of these technologies within this capacity building and training program, knowledge dissemination, also for the communities, not just with the practitioners. And the issues of partnership with the private sector, which is very important really in this regard. Those institutions may be not just relevant to the government, but even there are special ones or private ones. So the interlink between those private sectors and the partnership is very important. Thank you. Over.
Thank you very much, Hannah. I've taken note of the issues you've taken down the notes, and we'll share them. Jimmy, Felix, Okulo, you're welcome. If you have any contribution, I don't know whether they've been able to see the questions, but we are looking at different capacity building courses or programs or fellowships that may be out there. Who's doing it and what is being done, so that we can share with the broader group. Thank you. And if you're not able to speak, kindly just write the notes, and then we'll share them with Raymond, or the person who's leading this work. I think we don't have any discussions going on anymore, and we can go back in the main plenary by just logging off here and you join the main plenary. So I've been able to pick the notes that we shared here, and we share them in the main plenary. Thank you. You log off and log off onto the log back into the main. Thank you.
Welcome back, colleagues. I know some members are still in the joining in from the main group to the different groups.
Thank you.
Thank you very much members, for coming back to the main group. We thank you for sparing time to discuss in your respective groups. We have seen a lot of discussions on the chat, ideas. So we appreciate the discussion therein. So we wanted to hear from the groups. We only have 2 minutes each to share what has come from the group, starting with the group 1 on research. The minute taker could share what came from the group, and then we shall go back to the plenary.
Okay, sure. Group 1, we came up with several points to address the questions that we were given. For instance, the first question is that no sufficient evidence in research has been done in relation to climate and health contexts, since research is done in cohorts. And a recommendation for that was that data should be put in centralized systems for local and from local and international levels and also to avoid duplication efforts. And most of the data has also been generated by international organizations, with less being done regionally. And this can be attributed to the lack of expertise. So measures to be put, including capacity building for climate and health researchers, as well as generating tools, policies that address intersectionality of climate and health, as well as financing mechanisms to address climate and health research efforts. For question B, we saw that regional efforts have been trying to be done, but for national efforts, no data has been done. Therefore, it's a gap for the development and implementation of research agendas that address climate and health research. For C, we had a lot of organizations that are actually dealing with climate change and health. For example, in Africa, we have Makerere University Center for Climate Change, as well as Climate Action Network Uganda. We also have Busitema University and UKOBAC, which is a community-based organization putting women on the forefront of building climate resilience within the communities. We also have other international organizations, for example, the Center for Climate Change and Health, as well as the Tyndall Center for Climate Change Research in UK, as well as the Center for Environmental and Respiratory Health Research. For question D, we saw that some of the points that were coming up was East Africa, in Uganda in particular, the region is so susceptible to climate change events, such as it's prone to floods and flood disasters, as well as landslides that actually expose communities to health-related hazards. And it's prevalent in eastern and southwestern Uganda, as well as also North Africa needs more attention. At the same time, we need to consider the industrial mechanism and setup of industries in our region. We also had a point coming that the Sahel regions need a lot of climate and health research, because these areas are vulnerable to extreme weather events and vector-borne diseases, as well as water scarcity, and collaborative efforts and research fundings should be directed towards those regions. That was a summary of what we came up with to the questions that were addressed to us.
Thank you, Group 1, team on research. Members, I think you can give input to research that you can leave a group by group. So by this juncture, I wish to request Emily to take lead in moderating this. At least after every group, members can share what they think about the same section. Then we can go to another group. Yes, over to you, Emily. Emily?
Yes, thank you, Raymond. So at this point, I welcome any comments on the same, only 1 and 2 because of time is not on our side. Any reactions from the feedback we have gotten from group 1 as we proceed to group 2?
Reverend Canon Everett Mugarura here.
Yes, kindly go on.
Yes, thank you, Group 1, for the highlights. I especially like the information on the existing institutions that are biased on climate change. But I heard you mention an institution in UK, and I wondered whether or not that one was for our region. Not to be so biased and racist, but we are looking at African region and the institutions within the region. I thought that was, you know, our partner somewhere, but not necessarily for the region. And also, as to what extent these institutions have been popularized is not so much highlighted, and I don't know why. Maybe the group can help us.
Thank you, Everett. Maybe group 2, you can respond to group 1, you can respond to that as we wait for any other comment on your presentation. Anyone from group 1? Okay, as they think about it, I see we don't have any reactions from members. So at this point, I welcome the representative of group 2 to present their findings.
Emily, excuse me, I have something to share. I'll put up my hand, but.
Okay.
Okay, thank you. I'm Geoffrey Ogutu. I work with Reproductive Health Uganda. Yeah, on the aspect of research, I was also waiting to hear from my colleagues how they are trying to implement research, especially on some of our key critical sectors. And in this aspect, I'm looking at cultural institutions and religious institutions, because sometimes when we look at issues of climate and health, we may look at them as the intergenerational issues that has been there and they will continue to be there. So how can we spur our research and see the contributions that these institutions can make in advancing climate change adaptations and health in Uganda will be a bit critical. So as we plan, we can also dig deeper to have that insight. Then 2, there's also limited work around the sexual and reproductive health, yet there's a profound evidence that the SRHR and gender equality has a gross impact in promoting community resilience and adaptation to impact of climate change. So we can also have our discussions trying to connect the 2 nexus as far as health and climate change is concerned. Yeah, thank you so much.
Thank you, Geoffrey, for your feedback. I can speak on I'm not sure if group 1 had enough time to look into all these issues, but from this meeting, we'll come up with a report, and all of these issues that will be addressed, will raise from this meeting, will be addressed. And as soon as we have the report, we'll circulate with Raymond, and Raymond will circulate the report with you so that you can incorporate your feedbacks before it is finally published. I think that will be okay. For the sake of time, I think I'll welcome the speaker for group 2 to present their findings. Group 2.
Good afternoon, everyone. we had we came up with there are policies in health, climate, and in other relevant sectors that consider climate and health in integrated ways. We've had members from Uganda, Tanzania, Ethiopia, and South Sudan. Ethiopian policies on health.
Hi, Namukwaya. We cannot hear you clearly. Kindly increase the volume of your. Kindly talk louder.
Okay. There is sanitation sectors and adopting global policies in WHO. Then there is also no information of specific at the country information at the country level. Then there is WASH in Tanzania that is dealing with health issues strategy for national climate, building the capacities to adopt climate and health impacts. Opportunities, mitigation activities for sustainable public awareness not being done. Awareness raising is not so much, and mobilization of resources is limited. Then the level of awareness is limited among the actors. Policies may be available, but they must be compiled in one booklet, and they must be favorable and easy to be read. There is need for sensitization and publicization because it's a big challenge, and strengthening adaptive measures, and there is adaptive such as sorry. Researchers in health and climate change can be supported through increased funding to their projects, fostering collaboration between multidisciplinary teams, and promoting open access to research findings. Additionally, providing resources for technology and data analysis tools, creating platforms for knowledge exchange, and encouraging policymakers to integrate research findings into evidence-based decision-making can further support their work. Then from there, we had question B, which was, how can researchers be better supported to collaborate with policy makers in development? A policy to the standard need part of the stakeholders put up evidence-based policy. Effectiveness, some policies are general, aspect implemented and monitored. Creating platforms for research to participate in periodic review of researchers' implementation, and more specific to issues that can be supported through climate and health. Researchers need to be involved to see if they are creating impacts in their communities. And from there, we went to another question C. Sorry, there is also attendance of researchers during their research and record their findings. Then question C was, are there dedicated institutions that are focused for formulating climate and health policies on the names of institutions and location? Then in South Sudan, there is Water Ministry of Health that is located in Khartoum. There is also Ministry in charge of environment located also in Khartoum. Then in Tanzania, there is also a National Adaptation Program of Action. It is in the Vice President's office. Location is Dodoma. and also health, NIMLE. It is National Institute for Medical Research is in Dar es Salaam. Then in Ethiopia, there is also a Ministry of Environment, Climate Change and added on recently. It is in this location is Addis Ababa. In Uganda, we have multi-stakeholders process. We have NEMA, National Environment Management Authority, the Ministry of Health, and Ministry of Water and Environment. Location is Luzira. The Ministry of Health is Kampala. Then NEMA is at Jinja Road. Location is at Jinja Road, and also we have Uganda Climate Change Department Community. Due to capacity building, Makerere, we also have Makerere University that concerns research and the policies formulation. Location, Kampala. Then question D, question D, how can research evidence be made more usable and available or to teams of researchers, policy and implementation partners in climate and health policy and action? We have more usable and available. They have to be more usable and available, means of accessibility, platforms, creative ways of disseminating findings, submission of abstracts, mainstreamed in all sectors of the environment. There is a big difference between researchers and, there is also provision of resources, collaboration with the stakeholders, advocacy efforts, dynamic information exchange mechanisms, capacity building and to researchers, interactive workshops to researchers, and engagement of stakeholders in sharing knowledge about climate change. Then we talked a little about finance. We talked a little about finance with at strategic point of view. In Uganda, it has been taken seriously. A climate finance unit has been set up on issues of climate change, centered from and also mobilizing funds for climate change and health. There is also inclusion, finance and inclusion. Uganda has taken it seriously by including marginalized women, people with special needs, or people with disabilities, youth, and the girls. That's all we have heard about our discussion. Thank you so much for listening.
Thank you so much, Namukwaya, for the findings you presented on behalf of Group 2. At this moment, I welcome one of two people with reactions to respond to the feedback before we go to Group 3. If you have a concern or a reaction, kindly raise up your hand or just feel free to speak, to unmute and speak. I can't seem to see any hand or anyone with a reaction. If that's the case, I don't want to close anyone out. If that's the case, I'll welcome the representative of Group 3 to give us their findings. Thank you.
Thank you, Emily. This is Reverend Canon Everett Mugarura, representing Group 3. I'm sorry I should have introduced all the members, but I had a very vibrant group. I thank you for that arrangement. We had the assignment to do with capacity building, And the first question was on whether or not there were integrated climate and health courses or fellowships in our region in form of short courses or at master's level or PhDs. We looked through the whole region, and specifically on capacity building for climate change and health. We did not see a well-defined or specific institute that was out doing that. Integration, yes, with online courses, but not also at lower levels, apart from the PhD programs that try to integrate the climate change in relation to the focus of their fields like GBV and sexual reproductive health courses. And you find they try to relate and to integrate climate change and health. Generally, we felt that much as most institutions, especially when they those which are doing public health, tackle a little bit on environmental health, there hasn't been deep and well deliberate instituted programs in the curricula to specifically focus on climate change and health, and specifically again on research. So we felt that was a big gap that has to be addressed at regional level. And then on whether or not there were exchange programs for professionals, definitely, if we don't have the institutions in place, it affects even the exchange programs. What do we exchange? So we felt that was even a bigger gap that we as people who are coming on front must address. On the third assigned question, what other kinds of capacity building in community health, in climate and health climate change and health are taking place in the region? The members brainstormed on so many things, and we felt that there was some effort thrown out into the communities. Like, we have webinars now coming up to raise awareness. We have workshops like this one talking about specifically about capacity building and health, and other conferences, but also majorly we have the WASH program that looks at health and how it interacts with the climate in most part of it. But still, we felt we are looking at small pieces of the bigger picture that we are supposed to look at. And therefore, we concluded here saying that whatever we are trying to do is still scanty, and there is no concentration on the big picture. And even the research that is out there is not deep enough to provide the necessary information to inform programming in the appropriate manner that we desire. And then we also looked at financing, because capacity building and financing are part and parcel. But before that, there is the global language that we have with us. We talk of carbon programs. We talk of these green houses and the emissions. And the members felt that this language has remained foreign, especially to our rural populations. Hence, the need to simplify all these terminologies and the whole concept and in the context of the people in order for them to be in position to mitigate for the climate change impact that is already happening in our communities. So there is need to really, really go down to the rural communities and help them to understand all these big terminologies that we use on a daily basis without a clear understanding of what they mean in their day-to-day lives. Lastly, we talked about financing, knowing that if we are to do research on community and climate change and health, we surely, and even the interventions that will come with that research, we surely must look closely at financing of these interventions. And the question is, why are we crying finances? Because we felt that even when we have professionals in the region that would, if supported, would go out to come up with regional tailored innovations and manufactured products in trying to mitigate for climate change, and there hasn't been much of support in terms of financing. Even the global financing on climate change goes back to the same community that has raised this money, who again come with the products already made and just brought to us. Like an example is the solar, the solar system that we are using. All those are made from there. If you have any problem, you can't manufacture them. You can manufacture them here and tailor them to our climate and all that we are faced with here, using our local professionals, maybe in partnership with the other, the North, the global North. So we felt that was an area that we need to do a lot of advocacy for, and especially when it comes to COP29 conference, that in that conference that should be highlighted. And then we said that even as we look at the global North to fund those such innovations, we also need to look internally in our countries as a region. What is it we can do and initiate on our own using mechanisms that are managed by us through our countries? For instance, the vehicles coming to some of our countries like Uganda, there is taxation levied on these vehicles. What is that money for? What is it doing already? How can we make use of that so that we have a beginning point that we can sell again to attract more funding as we interact with the global North? Otherwise, we had a wonderful discussion, and we wished we needed more time, but this is a very good interaction and beginning point for us to begin to talk. But lastly, if we have to have impact, the young people must be at the center, part and parcel of all these interventions, including research and advocacy, so that we are assured of the present and the future interventions, and sustainability is part of that. So the next generation must be put into consideration in all the research we are going to do and the interventions, and raising awareness and building capacity. Minus that, again, we'll be doing a disservice to our nations and the region at large. Thank you so much, and God bless you.
Thank you so much, Evat, for your presenting the findings of Group 3. Yeah, indeed, this is just the beginning, and I believe through YardNet and other partners, this is just the start of similar targeted discussions that are meant to enhance the field of climate change and health in Africa. So from the chat, I can see Yawo has raised his hand. I believe you have something to say with regards to the presentation. Kindly unmute yourself and feel free to raise your sentiments on the same.
Yes, thank you. Thank you very much. I'm very sorry for not being able to attend a group discussion because we are having an internal meeting here. But I want to add some points about the capacity building section. Yeah, for the capacity building here at African Institute of Mathematical Science, we do have some programs where we include climate change and health training program. So here we have two programs. One program is a research program working on climate change and health interaction. And the second program is about a malaria modeling program, where we have a course for master's degree. We have a program for a PhD degree also. Those people are trained to be able to model climate issues, impact on malaria in the whole Africa. So African Institute for Mathematical Science is not only in Rwanda, it's in some countries also in Africa, such as Senegal, Cameroon, and Ghana. So this institute also has some students there where they are training for this purpose. Also, we have another master's program here on climate change specifically, where we train also people for how to manage with climate issues. So for the training program here, yes, we have some some programs for training, and also for the projects on climate and health interaction. The purpose is to develop like some statistical, some indicators that can be used for annual reports of climate change impact on health, on some kind of diseases such as waterborne diseases, such as zoonotic diseases, and so on. And the end of this project would be to train some statistical institutes, those who are specializing in reporting, like annual reporting, to also include those indicators that will be developed in their annual report, so that we can also have like an indicators showing that yes, this year climate change has impact health in this way. So this is globally what we are doing here in EMS. So thank you very much.
Thank you, Yao, for your feedback. It's good to know that at least we have programs that have integrated health and climate change within Africa, and I think such need to be replicated for us to have a bigger impact and to have more discussion centered around the same. So I see Josephine's hand up. Kindly feel free to unmute yourself and comment on the topic.
Yeah, thank you very much, Emily. And this is Josephine from Planned Parenthood. I actually want to add on to what Evert has inputted in room 3. I think we ended up again splitting into 2 rooms, because at one point Evert was leading us, and then he kind of went off, and we didn't have someone to like moderate the session. So I picked up a few things within the group that remained in room 3.
Sorry about that.
Yeah, and my contributions is, I think one of the members indicated that in terms of capacity building, there's been a strong focus on primary healthcare workers, and this is being done by AMREF University in Nairobi, and the course is structured to tackle the content around climate change and health crisis, health system resilience, primary healthcare, and healthcare providers. And it's targeting healthcare professionals, programmers, policymakers, environmental health experts. And this is with the University of AMREF University in Nairobi. That's an addition to what Evert presented from the group. The other, generally, I think on our group, there's a strong feel like there's not much information around here, on who's doing the capacity, around where the courses, where the masters, who's doing that, where there's generally limited information. So I would say what is coming out from the group is we really need to dig in and probably share more information and deep dive on who's really doing what, so that information is more available to many people, so that it actually contributes to building the capacity in this space. Because that was really what was coming out. People didn't really have much to contribute to the different questions. The other contributions, the Uganda School of Public Health, they have the Uganda Public Health Fellowship Program, which trains fellows from different backgrounds. And also they've been able to integrate environmental health. So that is another place that we can look at to increase on the capacity that's being built around these issues on climate and health. But generally, we had someone from the Environmental Institute of Sudan indicated more of like their gaps and the number of gaps. And because of the gaps and not knowing where they need to be pointed, where they can get more information to actually just be able to get more information around climate education, and as well as all the different issues that they are grappling with. They really don't have that, and that came out strongly. But I could say generally, the information around these questions is really not really there. So it's an area that we really need to deep dive and get to point people to where they can get more information. Thank you very much. Over.
Thank you, Josephine, for adding up to group 3. And I think you're right. And I know that at this moment, most of the work that is being done is either segmented or fragmented, and we might not be able to know what the different organizations are doing to promote climate change and health in Africa. So that's why we need to have an idea of what is going on and build capacity on the same, so that the different actors may know where they need to come in and add their voices on the same. And I believe as civil society organizations, we are better positioned to amplify the voices of research and policy, so that this information is widely known within our respective countries and in Africa at large, and even reaching the people in the communities. So I thank you for that information. And I don't know if we have anyone else who wants to react to the feedback by group 3. And I'm not seeing any hand up, and so I believe I'll welcome the...
Emily, maybe the members I had, if there is anybody to add a piece of information, if there is.
Okay, let's not close anyone out. If any member of group 3 wants to add any more additional information, feel free to voice your concerns. I can't seem to see any hand up, and I believe maybe you tackled well all that you discussed in your group. Oh, I can see Peter Owiti's hand is karibu sana, Peter.
Yeah, thank you very much. I just wanted to add about the role of the government, that the ownership of the government and the social contracting, because we see, like in my country, there's a lot of money that's being channeled on climate change and to the government. And we, as civil societies and NGOs, we don't see that money. And so we need also that partnership, social contracting, so that we are able to respond adequately, other than it's a one, it is a one stream affair. We have seen the partnership that is working in Global Fund, where the civil society holds a percentage of the money, and the government holds some part of the money. So we would like the government the government and our donor communities that comprehensive partnership is important moving forward, so that we don't have just the government being responsible for the climate and health, but also the communities are also empowered and given through well-organized policies to be responsive to the climate and health. Thank you.
Thank you so much, Peter, for your comments and feedback. And I think those are aspects that should be factored in. So I'm not sure if we have anyone else who want to say something before we proceed to the next group. Yeah, so at this moment, I welcome the representative for group 4.
Wait, Emily.
Yes?
Emily, just a quick line.
Yes.
We are saying that research in all this conversation, research is very, very important.
Yeah.
So that we can have evidence to influence those parties that may not be on the know of what is happening in as far as the impact is concerned, and use this research as a tool for mobilizing finances for more research and also interventions. So using research as a tool for generating research around this field. Thank you.
Thank you, Evan. That's why I think we have this forum, because the findings that we have had from this session will be shared with Wellcome, that is funding this project, because Wellcome really wants to invest in Africa, but they cannot invest without knowing the areas of priority. That's why this session was very important, to identify the gaps and things that need to be addressed, so that they can know where to channel their funding and which areas need to be prioritized in this field. So that will be will come out strongly in the report that we're going to develop after this meeting, so that necessary actions on the same can be taken. Thank you so much, Evert. And I think we don't have any other comments. Let me not close anyone out who wants to share something. But as you think on what to add, I welcome the presenter representing Group 4 to share their findings.
Okay, thank you so much, Emily and the team. Geoffrey, I will be standing for Group 4, but my colleagues will join as well as we proceed with our discussions. Yeah, as a Group 4, we're trying to look at issues around intersection collaborations, and also trying to help to identify critical stakeholders that can be of help in this. So as a team, first of all, I have to appreciate the person who created the groups. It was a cross-cutting breakaway room with the participants from various countries. So it helps us to bring a lot of learnings from various parts of the country across Africa. Yeah, so quickly around the modes of collaborations, as far as the climate change and health is concerned, the team agreed unanimously that there is a limited collaboration in this area at the Africa region. And we tried to identify the key aspects that can be taken into consideration as we move forward. And one of the aspects that was highlighted was around collaboration in terms of capacity building. We realized of health and climate in a segregative way, where institutions develop their own curricula and utilize their own understanding to pass on this information to key beneficiaries. So as a group, we felt that as a region, we may need to invest much in having a uniform curricula around health and the climate change, and utilize this to strengthen our capacity building platforms. Then on the same aspect, sorry, you forgive me, where I said there's a health facility, so there will be some echoes of your children who are getting treatment. Yeah, then we also looked at collaboration in terms of research. And we said that for Africa to feel the impact of climate change and health, all actors from civil society, from government, from community level to invest much time and resources to strengthen their research and collaboration, and also steer individual institutional participation in this aspect. So as we look around how to improve the area of our work, let's try to invest in attracting potential individuals, organizations, or governments to carry out research in this area, and also do it in a collaborative manner, not only as one institution, because it helps us to bring in the aspect of connections and also various opinions that may be diverse in these aspects of climate and health. Yeah, then we also looked at collaboration in terms of advocacy. We also looked at advocacy as one of the areas that we can interest our governments, our civil society organizations, and other key stakeholders to work together jointly and have a voice, not only in Africa, but even at global level. All of us have been in global spaces like a COP, and you see that our efforts are disjointed because we don't have a global forum that brings our issues together so that we amplify it as Africa. So as we strengthen our collaboration, let's look at issues of advocacy as one of our critical aspects to invest in. Yeah, then we also identified issues of partnership and networking. And this one should not be only at civil society level, but even at community level. If we have programs addressing health and climate change at district level, how are we evolving other multi-sectorial allies that can be of help? For instance, we can be addressing health and climate change, but you are not looking at culture and religious leaders. Yet we feel that these people have a very bigger congregation that can be of support in our aspect of work. So as we look at broadening our collaborations and coordinations, let's look at partnership and networking as a very critical aspect to invest in. Then issues of financial resources. Yeah, we realize that our resources as Africa, we have limited resources channeled to climate change and health, but also the little we have is not well coordinated. Even the efforts that we have in mobilizing resources around this area has not always been well backed up as a joint team. Yeah, so members talked about the current loss and damage fund, which we can tap in as Africa, as a region, because we realize that we contribute less, but the impact are adverse to Africa as a region. So how can we utilize some of these discussions to strengthen our joint resource mobilization efforts, especially in the areas of climate change and health? Was one of the areas of collaboration that we identified as a team. Members also talk ministries and governments having intergovernmental collaborations. Like in Africa, we have IGAD, we have ECOWAS, we have East African Community, we have SADC. All these blocks. How can we support them to come together and push their agenda around health and climate change together? And how do we tap into their space as CSOs to make sure that our initiatives are felt and also are supported during their global discussions? I think that's one of the areas that the team managed to look at. Then also we had a task to identify critical stakeholders. and also try to see how they can actively be involved in discussions around climate change and health. And at our level, we said that these stakeholders are multi-sectorial and they run from community up to intergovernmental level. So at community level, we looked at community members generally, whom we looked at as the actual beneficiaries of all these initiatives, and also that the most hit by the impact of climate change. So when we are trying to break down the community member stakeholders, we looked at young girls, young women, we looked at opinion leaders, culture and religious leaders, and we said that these team members, for you to feel their participation, we must create and utilize the already existing community movements, and try to engage them to generate their own perspective and also have their own initiatives reflected into our planning processes as partners, as CSOs. If we don't engage them from the start and also have their issues raised, we may not really make them involved, because they may say these are not our own thing. So we propose that the members should make a deliberate effort to have community-led initiatives by having the community group members involved from the start. Then also we had stakeholders at the district level, where we all agree that based on your administrative structures as government, district stakeholders, for example, for Uganda, we have what we call currently the multi-sectorial planning processes. How do we have health, community, education, look at climate change as a cross-cutting issue, and mainstream it into their day-to-day planning processes? So as a team, we said that we should utilize the district planning cycles, first of all, to appreciate the nexus between climate and health, then also engage them to integrate issues of climate change into their district climate change adaptation plans. So that's an area that we can interest ourselves to make sure that we utilize the district to plan for some of these aspects. We're using the available district resources that they have. Then one of our colleagues also said that we should engage district into cross-learning events. If one district has worked well, how can we engage others to go and learn from them? And as they learn, they gain knowledge, but also interest themselves to invest in climate and health. Yeah, then at national level, the members also identified a number of stakeholders, ministries. Like in Uganda, we have Ministry of Water and Environment. We have other line ministries, Ministry of Health, Ministry of Gender, because we looked at gender as one of the key components of climate change adaptation strategy that we can look at. So at the national level, we are trying to see how do we build allies? How can we strengthen our collaborations with these line ministries and make sure that they invest the little time and resources they have in addressing health and climate change? So members talked of engaging them to formulate policies, but also if there are existing policies, how do we revise them to have a health aspect? So we use an example of Uganda, where we have currently the government and the Ministry of Health is working on a health national adaptation plan. And we are saying that this is an area where we can strengthen our health and climate change aspects. So how can other countries in Africa also have the same initiatives so that issues are made at national level across Africa are jointly done? Yeah, then also we said that under government, we can also engage our governments to support our resource mobilization efforts, especially around issues of climate financing. How do we tap into the government space to ensure that we leverage on their strengths as governments to tap into this global financing that is available for Africa to steer our efforts as partners in addressing health and climate change. Yeah, then lastly, we also looked at issues of private sector. We said that one of the key critical partner or stakeholder in climate and health is a private sector. And in private sector, we are looking at companies, we're looking at individuals, and to
I don't know if it's only me, but I can't seem to hear Geoffrey.
We also don't hear.
And the issue why we thought this was interesting was that sometimes to the
I think Geoffrey, I think has a network issue. If I don't know if he has dropped off. Geoffrey, I think he had a network issue. But of course, we shall capture more on this from his. Geoffrey, are you back? I don't think so. Emily, do you see him on the chat?
I
don't think so. I think he's dropped off. Yeah, but I think we are capturing what he was talking about in relation to the section there. Thank you. But you.
Thank you, Geoffrey and Tim, for that elaborate finding. And I at this moment I welcome anyone with a comment or any concerns. But as Geoffrey has said, I believe engaging partners from diverse stakeholders and sectors is crucial for the broad range of perspectives and interests and skills they bring into the discussion. So moving forward, even in our organizational levels, in the works we do, let's consider the aspect, the importance of including other stakeholders so that we can collaborate on the various projects that we have to do for the benefit of our community and Africa at large. So I'm not sure if we have anyone who has a comment, or I can see Evert's hand up. Evert?
Yes, yeah, thank you, Emily, and thank you, Group 4, for the elaborate, presentation. My quick concern and emphasis is on the research structures that we already have in the country, and especially in our higher institutions of learning. It is not highlighted so much, yet we have all these universities, including my university, Uganda Christian University, where we have a whole directory of research. And I think this should be deliberately done. And for us, we are even more actively involved in research from a health point of view. And therefore, linking it with climate change and having a conversation along that line from this collaboration would add value not only to the institutions but to the whole advocacy that we are trying to come up with, because research is a form of advocacy. As you disseminate information, you're actually advocating for what is out there. So I want to see the university institution and the universities that have well-designed research institutes brought on board to be part of this initiative. Thank you so much. Particularly me, I'm from UCU, Uganda Christian University. I would be very happy to see the Director of Research, where we are part of coming on board and being actively involved, because I know they can influence a lot in this direction, including funding. Thank you.
Thank you, Evert, for your comment, and I can agree with you. And this is a discussion we've had at an organization level about the research that is being conducted in universities, because a lot of research is being done, but they end up being shelved and not propagated, and so it doesn't impact the community as it should. And so we are having discussions on how can this research be translated, even for policymakers, so that we can come up with the best approaches on how to deal with these issues that are being discovered in this research that is being done. So, and we also have the idea like most of the students just do this for purposes of graduating. Okay, they don't put more emphasis on the impact it will have afterwards, because after they've graduated, they forget the various researches that they did. And I think this narrative should be changed so that even the people we have in universities beyond graduating, they should consider making sure that the work they do is impacting the people they investigated. Thank you. I can see Peter Owiti's hand. Kindly, Peter, unmute yourself. Peter?
Hello. Yeah. Did you say Peter?
Yes, I can see your hand up.
Yes, my hand is up. One of our colleagues talks about collaboration and networking. And I was wondering if this group that we are today is also collaborating or is linked to COP29/UNFCCS, CSOs global platform that is preparing for COP29 in Azerbaijan in November 11th to 22nd. Because we have frequent meetings and we are seeing how the CSOs will participate. We are seeing encouraging governments that wherever they are traveling, they must carry CSOs with them, they must carry youth with them, they must carry the media with them as part of the country delegation. So I'm wondering, in our collaboration, somebody talked about how we should collaborate and have one voice, particularly for the African platform.
Thank you, Peter, for that. I think Raymond will be better positioned to respond to that. Raymond, please.
Yeah.
Yeah, thank you, Peter. Thank you very much. Peter, earlier on, I had brought in Dr. Edwell from Nigeria, who is now leading us on the COP29 processes as civil society. So that's why we have networks here. So I think all of us here, we want to give you our contacts, we want to share with them that can be added to the group. There are already discussions with civil society for COP29 already. I've had one last week. So Dr. Edinodo and the team, they will be linking us to that. So you're welcome to give us your contacts. We're going to share with them the team engaging civil society on the same. So this opportunity we're going to have as well, having here the opportunity for us. Thank you.
Okay, thank you, Raymond, and thank you everyone too. I'm not sure if we have any other reactions to the presentation that I made this morning? If not, mine is just to thank everyone for their time. It has been such an enriching and engaging session. Particularly, I've learned a lot from this, and I think there is much that we need to do as Africa to move the climate change and health agenda forward. So mine is to thank you very much, and also to thank Raymond for spearheading this. And I believe we have room to discuss more and to collaborate in future, and to know how we can further this agenda forward beyond the conversation that we've just had here. So at this moment is to thank you from Marine. I have Anne here. He was not in the morning. Anne, can you kindly say hi before we give the floor back to Raymond? Thank you.
Okay, sure. Thank you, Emily. My name is Annie Rongo. I'm an intern here at AREN, and I'm grateful to have been part of this discussion. I've really learned a lot and looking forward to engaging with you again. Thank you.
Thank you, Anne. We also have Gogo Ezekiel. If you can hear me, kindly say hi before we usher in Raymond.
Hi.
Ezekiel, can you hear me? Okay, I think he is not in a position to talk. But all in all, thank you very much. And back to you, Raymond.
Yeah, thank you very much. I wish if you accept but also to thank I know you have a colleagues who work with the Africa Population and Health Center for the great work done for this, and members for joining us, being with us today. We have gotten your feedback in the chat, you have gotten communications. As I said, we request share your details in the chat. You're going to link your opportunities for COP29. Also to inform you that there are processes also going to happen. For example, they have the Africa Regional Forum on Sustainable Development happening in Cairo at the end in April. Also, it's an important forum for this. There are teams in Nairobi already right now at the UN Environment Assembly. All those opportunities to tap into, and the COP29. So I believe working with Arena and the team, we look forward to working closely. So thank you very much. I wish on behalf of the organizers to thank you, but also to bring on board Emily to close this session, because we are doing it working closer with you. Thank you. Over to you, Emily. Any way forward and processes. Thank you.
Thank you, Raymond, once more. I don't have much to say, but to thank you and apologize. We have eaten 1 hour, 7 minutes of your time, because we intended to finish at 12. But because the discussions were very much engaging, we didn't see the need of shortening it. So we thank you for sparing your time. And also I take this opportunity to welcome you for the third webinar that we have that will happen this Friday. So feel free to register and feel free to
I had a bad network today, but I hope to.
Yes, feel free to join in. We'll be having
better next time. I was in the hotel, had a meeting, so I just went to the lobby. Maybe the network there is also going to go bad.
Raymond, kindly.
So I wish to.
Yeah, we'll be having our funders as part of the conversation. So kindly feel free to join whatever questions you have regarding the climate change agenda in Africa. You will have the time to raise them. And as I'll kindly request all of us, if we can, to put on our videos so that we can take one group photo to publicize this event that we had. If you are in a position to kindly. And I'll ask my colleague Gogo if you are in a position to take the screenshots.
Emily, sorry, I am using the phone. I cannot take the screenshot.
Can you use Anne's computer? Or, okay, let me see what I can do from my end. If it won't take much time.
It's okay now.
Gogo, can I add?
The smile is frozen.
The smile is fading away. Just a minute, please. I'm trying to retrieve the app from my end. Gogo and Anne?
Technical hit in a few.
Sorry. You can keep on smiling. It's good for your health. It can add more life.
Just a moment.
So I hope members you have put in the chat your contacts. We need your contacts in the chat.
Yeah, sure.
Yeah, your contacts want to link you to opportunities, but especially in these processes we are on to deliberate on engaging in climate and health and such. We are growing in a cohort for Africa in climate and health research. So we want to have this cohort for civil society and engaging stakeholders in Africa. So definitely that first cohort is with you who have joined us today and those who have moved off, who have your contacts already. So thank you very much. And share your contacts, your names, organizations, and the contacts, email, and organization positions. We are coming up with a database for this. And Erin is going to lead us on this. Thank you.
Yes, kindly smile. I can now take the photo. Kindly put on your best smile as we take a selfie.
Hello. Emily.
Yes?
As you put your contacts, kindly put your codes.
We are back now. We can do the screenshot.
Okay.
Now everybody to turn on their videos.
So Emily, say hi to Dr. Johannes. Colleagues there as well. So we didn't see the teams from Pakja. I know we had a meeting with them yesterday, but I know you're going to say the greetings. I know they were busy, they told me. Thank you.
I'm waiting for everyone to turn on their videos.
It's taking too long and
Emily, our smiles are melting.
One last chance.
Good to see you, Rosalind. Good to see you, Tims. Good to see you, Marcin. Hey, everyone, Josephine and the teams. Thank you for sparing time being with us. We look forward to greater working closely.
Thank you, everyone.
Thank you.
Thank you. Session.
For your time.
Thank you very much, and good to. So bye for now.
Bye.
We shall share the recording and the report as Emily has mentioned. Thank you.
Bye.
Bye.